Thank you very much for keeping it right here on KBC Channel 1. My name is Aguko. Thank you very much for your tweets. We are seeing many people are engaging with us on our Twitter platform. If you haven't, be part of the conversations that we have just had at Jane Wambui, at Aguko, and officially at KBC Television. The hashtag to use on Twitter is Good Morning Kenya. Right now, we are changing the gears into matters health. This morning, I'm joined by Dr. Wanjiku Mude. She is an ophthalmologist from the Lions Side First Eye Hospital, although in Loresho. And karibu sana.
Thank you very much.
Now this morning, as we talk about eye care, we shall dwell into different categories of different groups of people. We shall start with the kids or children under the age of 5. Even dwelling with the people, kids even from 5 years all the way going through to adulthood from around 50 years of age. And the third group that we shall also dwell in is people from 50 years all the way through to old age. How can you have an eye healthy kind of a lifestyle when it comes to the causes, signs and symptoms and treatment of eye conditions? Is it possible to have a healthy eyes? And that's the first thing. How can someone have healthy eyes?
That's a good question. The eye basically takes good care of itself. So really what you want to do is keep things from entering your eyes. Okay, so if you have in a dusty environment, then you want to just clean the outside of your eyes. The inside of the eyes take care of themselves.
Now, most people
have tears.
Most people normally like rubbing their eyes with their fingers.
That's a bad idea. One, because our hands are usually very dirty, so we don't want to handle the eyes too much. We also are advising against using salty water or soapy water into the eyes. As I said, the eyes have tears. They have a self-regulatory mechanism, so they'll produce tears. You find when you have a foreign object entering the eyes, you start blinking very fast and tears will come out. That's the eyes' safety mechanism. It will clean itself out. So even naturally, you're always producing tears to lubricate the eyes and to clean out any debris that enters the eyes. So the eyes themselves you don't need to pour water inside the eyes, just clean around the eyes.
So some people normally get, for lack of a better word, wakona woga. Something enters the eye and then machozi imetoka, mtu anasema, kitu lingia hadi machozi katoka kwa macho. So having tears is actually a mechanism for the eye naturally.
Exactly. And you find even when you're crying, for emotional reasons, you find you're also sniffing. That's because tears, there's a duct from the eyes that goes out through the nose. So you find tears actually track from the eyes to the nose when you have an excessive amount of tears. So the tears have a way of regulating themselves, and if it's in excess, then they'll come out through the nose. So we're always producing tears to lubricate the eyes, and the eyes don't need much help other than a good balanced diet. Carrots, we mention a lot. It's true. Carrots do.
So eating carrots gives you healthy eyes?
It does. The vitamin A that's contained in carrots actually does help.
Oh, I thought my mother was just disturbing me with the cooler carrot.
Enjoy your carrots. Enjoy your carrots.
Enjoy your carrots.
Yep.
Tips from home. Enjoy. Still from the studio, the doctor herself. Eat your carrots.
Yes, please do.
Does the eating carrot also help in building your eyesight when it comes to during the night time?
That's a very good question, and that's very true. That's because the carrots help in building the cells that are used in night vision that are in the retina. The retina is at the back of the eye. I've come with an eye model that will help us understand more about the eye. So the back of the eye, if we take apart the eye,
so
this is the
this
inside.
Is just an eye model?
This is an eye model.
So the front is this side?
This is the front. This is our cornea. This is called the cornea. It's supposed to be clear. Then you have the iris, which is the colored part of the eye. So you find in Caucasians it will be green or blue. This part. So in Africans and in blacks, this will be brown or black. So that's the iris. Then at the back, we have the lens. This is the lens. So that's at the back of the eye.
When you talk about the color of the eye as you continue, does it have any importance, the color of the eye? Most people may want to have different colors. Mythically, seemingly there's some beliefs about having a different color.
Well, not really. It's just that the darker the color of the eye, the more the pigment. So same with our skin color, the brown and the black irises have more pigment. So the implication is that when we are doing any eye surgery on the eye, our pigments are more sensitive. So when you touch the iris when you're operating, then it releases a lot more pigment inside the eye as you're doing the surgery. Other than that, really, not much.
Not much.
We have had some few patients who have different color eyes. Like one eye is color blue and another one is color brown, which I find very interesting.
Is that a
it's not a problem at all. At all, it's not a problem.
Okay, continue.
Okay, so this is a gel that usually inside the eye is called the vitreous. We'll put it aside for now. So the back of the eye is called the retina. I don't know if you can see this.
Okay, maybe you can display it. Oh, you can be able to remove it?
No. Okay, so the back of the eye is called the retina, and you can see on the retina we have blood vessels. Okay, so the retina is where we have the cells that use up the vitamin A that comes from carrots. Yes.
So it is from the retina that gets the vitamins that we acquire from the carrots.
Yes.
So the retina builds up to our vision, seemingly from what you've said.
Yes.
Okay. Now, if we talk about now the eyesight, at what point should we say that someone has bad eyesight or someone has poor eyesight, rather?
Okay, so as you can see from the eyes, there are very many points at which the vision can be affected. It can be from the level of the cornea, can be from the level of the lens. These two are supposed to focus the image so that it falls very sharply onto the retina. Okay. So if any of them are affected, then you'll have poor vision.
At any part of the retina?
Yes, any part of either the cornea or the lens. Again, if the retina is not able to receive that image clearly, then you'll have poor eyesight. So that's why, really, you cannot diagnose without doing a proper examination.
Okay. Now, we said that you're going to divide this into different classes or different groups, starting with kids under the age of 5 years. And for the benefit of the viewer, we are able to classify these things because of age determines your eyesight, seemingly, right?
Yes, and there are conditions that specifically affect the age group under the age of 5. And then between the ages of 55 to 50, then there are conditions that tend to affect or tend to manifest at that age. So we felt to be prudent so that we don't miss any particular condition. Okay. Yes.
So what are the signs that maybe a child is having vision problems?
Okay.
Younger than 5 years old?
Younger than 5. There are some children who will have what we call cat vision. Mothers may notice, especially at night, that there's a white reflex. They call it cat eye in the middle of the night, because at night when the lights are dim is when the pupil, which is part of the iris, will become wider and they're able to see inside the eye. So there's something white inside the eye.
Okay, so how will you be able to notice it during the night? You utamulika torch?
No, it is the mothers who will come and tell us, iko kitu ya white. There's something white inside the eyes, and they usually see it at night because the iris and the pupil become wider, and therefore that could be an issue from anywhere from the lens to the inside of the eyes.
So this part becomes wider?
This part, exactly. This part becomes wider, and they're able to see inside the eye. So they see something white. So that could be anything. It could be a cataract. Children can be born with cataract. It can develop as they grow older.
What is a cataract?
A cataract, good question. Cataract is when the lens, we have a natural lens inside the eye, and it's meant to be clear. But in case it turns white, it starts to become milky, that's when we call it a cataract. Cataract will usually happen in older people. That's above the age of 50 upwards. Diabetics also tend to get cataracts a lot. But there are a few cases where children are born with cataracts, or with age, as they grow older, they develop cataracts.
So what leads to having cataracts?
For some children, it's genetic. You find in the family, they tend to have cataracts at birth. Other children with Down syndrome, they also get that. Malnourished children get cataracts as well because of the imbalance of electrolytes and dehydration and such. They also get cataracts. In case of trauma, injury, children play with sticks a lot, so you get that a lot. Stick injury, if it goes through, touches the lens. The lens is very sensitive, can also get cataracts.
So here we're talking about cataracts.
Yes.
We are talking about you talk about
The
cat?
cat eye. The cat eye is,
Cat eye.
is a simple terminology that they give because they see a white thing inside the eye. So it could be the lens, but it could also be, there's a form of cancer that also occurs in children, which is what I wanted to highlight.
Okay.
That any white reflex inside the eye should not be ignored. We
Anything
cannot tell
whitish,
you
don't
anything
ignore.
whitish. Do not ignore it. Don't say I'll take it to the health center. Please take it to an eye specialist to have it looked at, and we need to look at it thoroughly to determine what it is. If it is a cataract, then it will need surgery. If it is a cancer, then we know what to do with it. The earlier we get to it, the better. It will not go away with time.
You've mentioned if it's a cataract, it needs surgery.
Yes.
So anyone who has cataract, for them to have it removed, they should go through surgery regardless of the age.
Yes. Yes.
Okay.
Yes. Even the very young, the earlier we do it, the better. Because if a child stays for long without receiving visual input to the retina, that means the cataract is blocking any visual input to the retina. So the retina becomes lazy.
Can it lead to blindness?
It can. It can. That's a very good question. It can. If a child is not treated for cataracts as soon as possible, they do go blind. And that's not because the retina was unhealthy. It's just because it learned not to receive any visual input.
Then it means that, as you had mentioned earlier, that cataracts develop as you get older. So our old folks have cataracts, so they should all go for surgery.
Okay. So
Is that the
there's
implication?
not really, because it's the children who are learning. It is their brains that are learning. The adult brain already learned, already knows what it saw, it already knows colors. So if they're already past childhood, and that's up to the early teens, they're not going to develop blindness because of lack of visual input. So an older person who has cataracts will not go blind because of cataracts, meaning the cataract will just block the vision. But the moment you remove the cataract, then they'll be able to see again.
So it can be removed even at old age?
Yes, yes, yes. Do it all the time. That's what actually Lions is doing, because we do outreaches all the time to remote areas. We get patients who have cataract surgery who are not able to reach our services, bring them to the hospital and do the cataract surgeries.
Okay.
Yes.
Now this is now back to the kids now. So once you notice these things, are these the only things that if a mother notices, you can be able to detect eye or visual impairment with the child?
No, that was one of the things. Another common thing with children are eye infections. Children get eye infections a lot, particularly when they start going to school because of contact with other children and touching their eyes and whatnot. So anytime you notice swelling of the eyes and a lot of discharge, pus, yellowish discharge from the eyes, two things. One, see an eye doctor. Let's not play around with children's eyes. Number two is strict hygiene. I tell mothers all the time, get hand sanitizer, cotton wool, not bathing towel, because cotton wool you'll use, wipe and dispose.
Okay, so the aspect of taking even towels, wet towels, and then as mothers can sometimes do,
Even handkerchiefs.
even handkerchief,
Yes.
and then you put some liquid on it, maybe water or even your own spit.
We spit on it.
You spit on it. It's not advisable.
Not when, you see, our mother used to do that when you have maybe matongo or, yes, that's what our mother used to do. Yeah, when the guests are about to arrive, they do that very quickly.
Unakuita kuja.
Yes, kuja. Yes, exactly. But in case there's an infection, the health aspect has to go up a notch. We need to be more careful. That time when there is an infection, no, we switch to cotton wool. We wipe with clean water and we dispose of the cotton wool. You see, a bath towel, even if you clean it with soap and water, will not get disinfected. So you keep reinfecting.
Okay, okay. And how do you rate the cleanliness of your towel or handkerchief? How can you say that now I can use this to wipe my child's eye?
We don't, if the eye is healthy, as long as you have washed it with soap and water, Actually, we've covered quite a bit of the bacteria because we're not aiming for sterile. Sterile meaning 100% bacteria free. But if
That's
you're
not the
dealing,
aim.
that's not the aim when the eye is healthy. But when you're dealing with an infection, we want cotton wool because it's not come into contact with the bacteria before. Okay, so you just put a bit of water, tepid water, then wipe and discard. So that's why we're not using the hand towel anymore.
Now, what about being cross-eyed in children?
Good question. Now, I'll take you back to the eye model. You can see around the eyes, there are muscles. See, there's a muscle. So you have
this dark part.
yes, this reddish part. These are muscles that control the eye movement. So you can look to the right, look to the left, and in synchrony. So the eyes both look to the right or to the left together. So you have cross-eyed when the muscles are not coordinated. You can also have cross-eyed if one eye is not seeing. So the brain tends to ignore that one eye. So it will not look straight when the other eye is looking straight because that eye is the one that is focusing. This other one the brain ignores and will not control the muscles in that eye.
And kids, normally, you can be able to see some children having this a problem. What causes it? Especially even people, kids who are even under 4 months.
So vision becomes sharpest at around 3 to 4 months of age. Before that, they only see a blurry image. So at the age of 3 or 4 months is when actually we pick up this squint. We call it a squint. So that's when a squint manifests. So as I said, that is because of lack of coordination of the muscles. And also, if one eye has poor vision, then the brain will ignore the muscles and that eye completely. So it will not focus because focusing and control of the muscles is a function of the brain.
So, so if the muscles are not coordinating well, it means there's a problem with the brain.
No, it's a problem with the muscle and the information coming from the brain to the muscles because the brain will ignore that eye for a reason.
Is it possible for you to avoid such occurrences, especially in a family? Once if you want a child to have straight, for lack of a better word, straight eyes.
Okay. Avoiding, no. Avoiding, there's not much you can do because you also find there are families where you have a squint running in the family. So you have the father and the grandfather or the grandmother used to have this. Sometimes it runs in the family, but can also be this is the first child we have ever had in our family who has had. So no, there's no avoiding it. What we can do is at the moment we notice it, we follow it up. Because if it's a function of one eye has poorer vision, you find when the children start wearing glasses, the eyes become straight.
So, if someone does not have glasses, can it be corrected?
If the issue was glasses, they'll need glasses, but we also do surgery on the muscles. We either shorten the muscles or lengthen them so that they become straight. Yes.
All right. And when it comes to now getting a pair of spectacles, how soon should someone get a pair of spectacles? From what age? What is the requirement of having spectacles? Because when someone has a problem with the eye, they would go to someone in the streets and everyone seemingly advises you, oh, you have a problem with the eye, they give you spectacles. What is the ratings there?
Okay. So the process of getting glasses has to first start from ensuring that you need the glasses and that the eyes are healthy. You may find that the eye is already blind and glasses are not able to help. There are patients who glasses are not going to improve your sight. Again, you might have a condition that needs to be sorted out before you get the glasses, or you don't need glasses at all. For example, if you have a cataract, you have something that is blocking your vision, there's no amount of glasses that is going to help you see past that block. We need to do so we need to first assess the eye and make sure there's no other condition before we go to the glasses. What I need a professional. Go have the eyes looked at in totality. Before then, glasses to me as a first patient are the last step. We first have to make sure that the rest of the eye is in good shape before we say, okay, let's see whether or not glasses are for you. Glasses are not for everyone.
So is there a right time for your child to get spectacles and a time that is just not right for them to get glasses?
I've had a lot of mothers who are very hesitant to get their children spectacles.
Yeah, they are concerned.
They are. I try to tell them it is unfair to the children when it is cold and you refuse to give the child a sweater. It is unfair. No, there's no such thing. It is unfair to the child if they are unwell, maybe have a fever, and you refuse to give them paracetamol. The spectacles in this case help the child to see. Let's not allow the myths that we have had before, that glasses ruin our children's eyes, keep us from doing what is best for the children.
Do glasses ruin the children's eyes?
No, they do not. No, they do not. What happens is that the same way the foot is growing, okay, and you find whatever shoe size the child was wearing last year, they're not going to be wearing size 5 this year if they're wearing last year. This year they'll move to size 6, and the foot will keep growing. And at some point it will stop growing. Same way, the eye is also growing. A child's eye is also growing. So we need to keep checking the power of the spectacles, and it will also keep changing. So parents will say, macho inaharibika. But really, ni macho inamea, inakuwa with the rest of the child.
Okay.
So they should not be afraid. It is not that their eyes are going bad. They're just growing.
What if at some point it grows so bad to the level that it gets to blindness?
That's unfortunate. We do have access to services that have low vision. We assist people with low vision, with canes, with high power lenses, magnifiers to help them to see. There are patients who have a condition called glaucoma, and we are able to assist patients who have that. We have canes. Glaucoma is a nerve disease. The optic nerve can get compressed. So we have a nerve at the back of the eye. When the retina collects the images, it sends them to the brain through the optic nerve. And that the optic nerve can get affected by a condition called glaucoma.
Okay.
So when you have glaucoma, then we can give visual aids, we can give the cane. We also work in conjunction with Kenya Society for the Blind to assist patients who have low vision.
Okay, so just show us one more time the areas that it affects on the eye.
This
the
is glaucoma.
Yes.
Okay. So glaucoma is actually a neuropathy, and a condition that affects the nerve. The nerve is at the back of the eye. This is the nerve. Okay. This is this yellow part. So the retina is this whole beige part. You can see there are blood vessels inside the eye. Then this information is taken to the optic nerve and straight to the brain. So the eye is actually an extension of the brain.
So the nerves, they connect to the optic nerve and goes all the way to the brain.
Yes, directly to the brain. Yes. So what happens in about 90% of patients, we have high eye pressure. And that presses on the nerve over a long period of time. So the nerve is made up of millions of cells. So the cells start to die slowly, slowly, slowly. And the vision starts the patient starts to go blind slowly. Usually it will start with the peripheral vision. So they'll not notice. So the vision starts to go slowly, and eventually they have tunnel vision. So they're not able to see the sides.
Okay.
Yes.
So, so we have that condition together with long-sightedness and short-sightedness. How do they vary? So,
good question. These are completely different conditions. As I said, glaucoma is an issue of the nerve. Now, long-sightedness, short-sightedness is a function of the cornea and the lens. These two are supposed to function to focus the image to fall on the retina to give you a sharp image. Okay. Think of a camera.
Just show us, even as you describe it, so that the viewers can also be able to see it. So we have glaucoma, a problem that
affects the nerve.
Affects the nerves.
Yes.
Long-sightedness and short-sightedness affecting the cornea.
The cornea. This is the cornea, and this is the lens.
Okay.
The cornea is responsible for 2/3 of the image. This one, 1/3. So together, they work together. They collect the image, the light, and they focus it. Imagine like your camera when you're zooming in and out. The two of them are supposed to give you a very clear image to fall on the back of the retina.
Is this the reason as to why, why do people squint their eye?
Very good. When we squint, we make a pinpoint. We make the image smaller. We eliminate the too much light coming from all over, so that we only see a small part of the image, and that falls clearly on the retina. So we are eliminating the amount of light entering the eye. So we only allow a small amount of image.
Okay.
So it makes the image sharper.
So the difference between long-sightedness and short-sightedness is where the image is formed.
Very good. That is true. In short-sightedness, it will form in front of the retina. Long-sightedness, behind the retina.
Behind? Wow. Okay.
Yeah.
Be part of this conversation. Quite interesting there. Dr. Wanjiku, right here joining us in studio. The hashtag to use on Twitter is Good Morning Kenya at KBC Television, at Jane Wambui, at Ram Aguko. What are your questions concerning the issues to do with light and concerning the issues to do with eye? Now, when it comes to short-sightedness, what are is it possible for someone to be able to gain back their eyesight?
To actually quite a number of ways. Okay, there are non-surgical ways of correcting short-sightedness, spectacles, contact lenses, then surgical ways like laser corrective surgery. And
for the record, I used to put on glasses, and I went to for that surgical one, the laser, laser surgery. And I would like us to just talk about that for a couple of minutes there. Through my experience, after going through laser surgery, I was partially impaired for a couple of days there. What is the process that you undergo through laser surgery?
Okay. So what happens, laser surgery is strictly done on the cornea. So we shave the cornea a bit, and depending on the power of spectacles that you had and the power of image we want to fall on the retina, that's what determines how much shaving is going to be done. Oh, okay. So there are people who qualify for the procedure. People who have thin corneas obviously will not qualify because we can't shave a cornea that is already thin. So the cornea has to be healthy.
Also, the cornea can be shaved?
Yes, using the laser. So it's micrometers that are shaved. So that's why it can only be done by laser, because it's very specific and cannot be done by human hands, because already the cornea is very thin. So we use laser to shave only micrometers.
So not everyone can be able to go through this procedure?
No. No, not everyone. The extremes of the refractive errors, people who have small refractive errors, less than 1, may not benefit much from laser. People who have very high errors, above 10, also may not benefit.
Now, you talk about refractive error. What do you mean by that? For someone who doesn't understand these terminologies.
I'm sorry. So refractive error just really means either long-sighted or short-sighted. That's in a blanket statement that those are called refractive errors. Okay,
so you'll have to repeat what you had said. So when you say small or low refractive error, does it mean long-sightedness or short-sightedness?
You can actually both. You can have a small degree of long-sightedness or a small degree of short-sightedness. Either way, if you only have a little bit of long-sightedness or a little bit of short-sightedness, then really you don't need the LASIK surgery. Okay. Contacts or a pair of glasses are what's the best bet for you.
Okay. Yes. So how can someone know that I qualify to go for laser?
The only way to know is to come to the hospital, then you do some tests, because we need to check how thick, how healthy is the cornea. We do a battery of tests. We also need to check the power of the refractive error, so that we know, is it too high or is it too low, or do you qualify, do you fall within the appropriate range? That's the only way to know really whether or not you are a candidate for this surgery.
All right. Yes. So with regards to now the laser surgery, someone can be able to get medical advisory, and through that you can be able to know if you qualify for laser.
Yes.
And the aspect of connecting diabetes and eye diseases, eyesight, what is the connection?
Very good. This is a pet project of mine. Diabetes.
It's a pet project.
It is, because I meet so many diabetics who come with high sugars and they've never seen an ophthalmologist. Diabetes affects the whole body from head to toe, okay? Because it is essentially a disease of the blood vessels. And as I have shown you, there are blood vessels inside the eyes. So what happens is diabetes makes the walls of the blood vessels weak. So they tend to swell and they can rupture.
So diabetes as a disease, that is what it does?
Yes. Yes. Anywhere in the body, that's what it does.
Wow.
Yes. So you have swellings in the blood vessels, and those swellings can rupture. So you have bleeding inside the eyes. So what we need to do is a diabetic, the moment they are diagnosed with diabetes, we advise physicians, send them to an ophthalmologist. Let us have a look so that we also record how the eyes are doing. Then if we find any bleeding, then we can do laser. As I said, laser is not only for the front of the eye, we also do at the back of the eye. So we arrest the bleeding using laser if needed. Sometimes the eyes can also swell, the retina can swell because you have liquid from the vessels bleeding into the layers of the retina.
Now with the laser surgery, does it come also with, is it determined by age also?
No, as long as, because we have young diabetics. Whoever needs the laser surgery gets the laser surgery. This is not age dependent. But diabetics, you see, tend to be the elderly. But we do have young patients who have diabetes. This is not only for the elderly, it is for any diabetic, whatever the age.
All right,
Yes.
so whichever the age.
Whichever
Now
the
from 5 years to around, let's talk about adulthood, 50 years. Now, during my time when I was putting on glasses, you know, I was born, and ever since, I've been putting on glasses since I was born till 2014 when I went for the laser surgery. At some point, I was told that you will go blind, and they were recommending contact lenses. And at the same time, I was having my spectacles. With regards to these two, contacts and spectacles, how should someone know that I prefer contacts or spectacles, or can they both be put together? Which ones are safer?
Really, as you said, it's a matter of preference. But sometimes you find if the vision is, if the refractive error is very high, the lenses tend to be very heavy. So you have very fat glasses, which are not very good looking.
Yeah.
So you might want to put contact lenses. Yes.
Mine are so thick.
Yeah, so in that case, especially if you're a bit younger, you really don't want to walk around with thick-looking glasses that make you look like a nerd. Although nowadays we have different technology in lenses where even high errors don't have to go with such thick lenses. They're a bit more expensive, but they're there. So in case you're comfortable with the glasses, then you can go with those. But if you feel you can do contact lenses, those require much more hygiene because you can't wear them for too long. They require faithfulness in terms of you have to wash your hands, you have to put them in solution when you're done with them, take them out after every 8 hours. Really needs training to know how to handle contact lenses.
Now, there are those people who put contacts for aesthetic value. Is that recommended? Is that bad? Is that a problem waiting to happen? Is that a bomb waiting to explode?
I don't have a problem with people expressing themselves in that way, as long as I said, they maintain hygiene. The eye is very sensitive. So if you're going to follow, unfortunately, the people who sell these cosmetic contact lenses may not be very clear about how to care for the contact lenses in your eyes. So maintain good hygiene. Don't keep them on for more than 8 hours. Remove them. Don't sleep with contact lenses on. When the eye gets an infection, it's very uncomfortable.
But can it at any point give you or lead to blindness? Can it give you blindness?
There are some infections that are very difficult to treat, and once the cornea goes hazy, it's supposed to be clear, then that becomes a rabbit hole. It can actually cause blindness. Now,
let's talk about makeup. You put on lashes there, you put on contacts there, you put on mascara there, you put on eyeliner there, everything. Talk about eyeshadow. Do these things have an effect on the eye? Personally, I see those eyelashes and I'm like, woman, would it pierce you?
Why are you hating? We are putting them on for you guys. Anyway.
Even glue.
Beauty.
Anyway, wow.
So now there are patients who are sensitive. There are people who are sensitive to anything you put on their eyes. Patients who have allergies. It's a really bad idea when you have allergies to put any kind of eyeliner or mascara on your eyes. The people who have allergies, they know. They itch a lot, their eyes turn red or brown. They know. Those people particularly should avoid any form of eye makeup.
Okay.
But really, if you don't have any form of allergies, by all means, go ahead. But at the end of the day, please make sure they wipe out the eye makeup to not sleep with eye makeup. Again, the eyelids have glands and they produce some oily substance, which is part of the makeup of the tears. But being an oily substance, the eyeliners that we put can block the outlets.
So eyeliners block outlets?
They can if we put them on for too long. You can imagine if I put eyeliner today and then I don't wipe it properly, then tomorrow again I put. So you have coating layer upon layer blocking the outlets. So you can actually have swellings on the eyelids, which can come as a result of poor
Is this
lid
named
hygiene.
batata?
Batata, very good. Those are the batatas. They are actually, these eyeliners and the makeup contributes to the increase in the batatas that we are seeing.
Big message to the ladies outside there. Makeup issues, I tell you. Now, moving.
All we have said is white makeup at the end of the day. I'm all for beauty.
You're all for beauty?
Yes, enjoy yourself.
No problem.
Yes.
What about those people who use eye drops on daily basis because their eyes are red? So they wake up in the morning, put the eye drops there. They're tired, they put the eye drops there. They feel sleepy, eye drops.
And actually, Ram, I've had a few patients who are in the media industry who do this all the time before they go on air.
So sad.
It's not advisable.
It is not.
It is not. What they do, their mode of action is they constrict the blood vessels. You have blood vessels feeding oxygen and food to the eyes.
Okay.
Okay. But now imagine when you constrict them, you block them. So the eyes look white, but really it's that you've blocked the blood from coming to the eyes.
So having red eye is not bad.
Too red is bad. Your eyes normally will have some bit of redness, and it varies from one person to the next. My eyes will not be as white as someone else's. Someone will have naturally red eyes, but everyone knows when their eyes are a bit more red than usual. That is a problem. But to want super white eyes is not natural.
So the myth that having white eyes is better than having red eyes is misplaced there.
In fact, it's dangerous, because when you put these eye drops constricting the blood vessels for more than a week, then if you get an infection, and the blood is the one that is bringing your immunity to the eyes to fight the infection, then you're predisposing yourself to worsening of the infection.
Okay.
Yes.
And so is this one reason why people have popping eyes?
No.
Ni kama nataka kutoka nje kichwa.
No, you can have popping eyes for different reasons. One, there are patients who have thyroid eye disease. Those ones tend to have, they have accumulation of material behind the eye and even around the eye, so they push the eyes forward.
That is one cause of the popping eye.
Yes. And number two is people who have shallow orbits. The eye sits inside the bone. So there are children who are born with shallow orbits. So the eye, if the eye is a normal size, then it doesn't sit nicely inside the skull. So those are the two conditions that will give you the popping eyes.
Now, when it comes to discharge at an adult stage, some adults normally end up always walking with handkerchief because they always have tears that come out of the eye. What could be the cause of that?
One, surprisingly, dry eyes. Dry eyes, when your eyes are dry, the eyes naturally will trigger a lot more tear production to compensate for the dry eyes. So really the solution is to give a good lubricant that will tell the eyes, okay, now that's enough. We don't need to keep producing the extra tears.
What causes dry eyes?
Okay, so patients who have allergies tend to get dry eyes a lot. Patients who are now using computers too much and we are not blinking enough. So that actually contributes to dry eyes in our population. 3 ladies get dry eyes a lot more than men because of the estrogen. We get dry eyes in air-conditioned rooms.
Now, when it comes to the computer, you're saying you take too much time on the computer.
We blink half as much when we are on the computer.
Are those rays harmful to your eye?
The amount of light, we have now a condition coming up because of the light from the screens And now we are in need more and more of glasses that reduce the amount of light. So yes, that light is giving people headaches. Even people who don't have a refractive error need, I'm finding more and more patients needing glasses that are plain, don't have any power, but really just have that coating to reduce the amount of light. So yes.
All right. Now, when it comes to drivers, you are on the road there, and you know, this Kenya. So full light, someone is coming on the opposite side. It may be a matatu or a personal vehicle, no offense to anyone, but it's on full light. Does this thing also have an effect? A driver, are you likely to have an eye defect because you spend most of the time on the road?
Well, we don't have studies that have shown that, but again, every time you have such bright light coming to your eyes, that's like temporary blindness, and that has been a cause of accidents. Another thing that I'd actually want to point out is the bright billboards that are now hanging around on our roundabouts. Those are hazards. Those are accidents waiting to happen.
There are accidents waiting to happen.
Those are accidents waiting to happen.
Those electronic billboards showing everything.
Right at the roundabout, those are accidents waiting to happen. And bright lights, we should really stop flashing bright lights at oncoming vehicles.
Yeah, we should stop. So message to all motorists, stop it. Sunglasses. Is it bad to have sunglasses? People always carry sunglasses within. A lady has the purse in the car. Is it an important thing to carry sunglasses? When you walk out of the house and you get to the sun, you get a very big headache. Yeah.
By all means, have your sunglasses and use them. The rays of the sun actually are not healthy to our eyes. They cause quite a few eye problems. So by all means, wear your sunglasses.
Even if you're driving, it's no problem?
Even if you're driving, it's not an issue. If the sun is bright, put on your sunglasses. However, the sunglasses need to protect against UV light. So the sunglasses that we buy on the streets are just colored.
So how can you know the best sunglasses to get for yourself?
The only way to know is to go to a proper optical dispensing unit and get UV protective sunglasses. So the ones that you're buying on the street really just have color on them. So they're not protecting you against the UV light. Yes. So we need proper UV blocking sunglasses.
Wow.
Yes.
And during this time, most people, age. We are developing technology and everything. People nowadays tattoo their eyes. The cornea, and it's quite alarming. Everywhere they decide to draw whatever thing, black, red, green, yellow, name it. What should be done with these instances? Is it bad to tattoo your eye for aesthetic value?
Okay. This has just come up. We're a bit wary of the whole touching the eye, but we are waiting to see. We are waiting to see. So really, we'll know 10 years down the line whether or not a patient who had the tattoo, whether the eyes went blind, whether they got an infection inside the eye, whether what happened. For now, it's a wait and see. I would really not advise for it, but I have no concrete evidence to say that it has gone wrong for someone. So we're waiting to see. Let the ones who
let those who have done tattoos be our lab rats.
Thank you.
As we're wrapping things up because time is not on our side, let's just talk about just giving us basic eye care tips. How to maintain your eye, how to have a healthy eyesight. What can you do for you to last longer in terms of your eyesight?
Okay. All right. Really, the best thing you can do for your eyes is eat a balanced diet. Eat a balanced diet. The eyes, like any other part of the body, require all the minerals and the vitamins. So eat a balanced diet. Number 2 is to clean your eyes, the outside of the eyes. Okay, so just when you're washing your face, just be a bit more thorough with the eyelashes, because that's where the outlet for the sebum is, the lipid that I was talking about. So just the outside of the eyelashes. Don't throw water inside or soap inside the eyes. There's no need. The inside of the eyes will sort itself out. Okay, so just removing any discharge that's on the outside, that you can do.
Okay.
If there's any sign of anything wrong, we have this bad habit of keeping medication that I was given last year because they are eye drops and I never finished them. I will go retrieve them or ask my neighbor for, I saw you with an eye problem, give me the one you are using. Our eye drops, because they're liquid, they expire within 30 days. So once I have opened an eye drop, 30 days, that's the max I can use it. So let's not use eye drops that we used before or someone else has used before. Number two is that we tend to go to the chemist to ask for eye drops. That's a bad idea. That's a bad idea. Prolonged use of steroids or a particular kind of can actually predispose you to glaucoma that I was talking about before. So you don't want to use steroids for long. You also don't want to use wrong medication for the wrong reason. Just go to an eye specialist. Let's have a look and then tell you what's best for you.
Wow.
Don't treat yourself, please.
Don't.
Don't.
What about eyelashes? Sometimes your eyelashes keep on pricking you, your eye. What can be done there?
Depends. Is it chronic? Because once in a while you'll have eyelashes coming out and entering your eyes, and the tears will sort that out, as I said. You'll shed some tears and the tears will wash out the eyelashes. But there are cases where the eyelashes actually turn inwards.
Yes.
The eyelid will turn inwards and the eyelashes will also keep scratching on the cornea. That's not good. We actually can remove the eyelashes via a method called electrolysis, which you do in theater. So we inject local anesthetic and we pull out any eyelashes that are facing the wrong direction.
I need mine to be removed. They keep on bothering me. As you're wrapping things up, the hashtag is Good Morning Kenya on Twitter. Thank you very, very much for coming. It has been a pleasure having you.
Okay.
Let's head over to Jane on the other side of social media. Jane, what do you have?
There's actually just one question before we release the good doctor. There's someone who is asking, loving the discussion. This is Jackson. He says, good discussion about eye care today on Good Morning Kenya. I would like to know more about the issue of astigmatism. Can it be healed, and what are the dangers when somebody is suffering from it? What is astigmatism in the first place?
Okay, good question. Astigmatism is a form of refractive error. So some patients are short-sighted, some are long-sighted. Astigmatism is a special form of refractive error where instead of the image falling ahead, in front, or behind, it is skewed.
Oh.
Yes.
Okay.
So it is skewed and it's very uncomfortable. So instead of an image looking as a dot, it looks like a series of dots lying on each other, and it's very uncomfortable. So the same way as other refractive errors, this is a case that can be sorted out by glasses. There are contact lenses, but there are some cases of astigmatism that can also have LASIK surgery done on them. Also falling within if it's too small, too little, the refractive error, or too much, then the LASIK surgery may not work.
So with these kind of issues, someone can also be born with these defects?
Yes, yes, they can.
Okay. Jane?
I think that's the major question that was happening here in regards to astigmatism. And of course, I actually love this discussion because I am short-sighted, have been since class 6, and this is quite enlightening to just get to know more about this discussion, especially for children, because you know, we're living in a time where we leave our children with phones, tablets, they watch the TV from here, and you know, we just consequently, the parents be like, ako sawa, but the long-term problems are just waiting to happen.
Wow. And it's quite alarming there. Even with our kids, taking too much time on TV. Does TV affect the eye of our children?
I'll give you a case in point. In Japan, because they study so much and they watch TV, more than 50% of the children in Asia are short-sighted. Because from the time they're born, their eyes never learn to look at far objects. So most of them are short-sighted. That's the highest rate of short-sightedness in the world. So there's a campaign going on in Japan for go out and play, go out and play. And therefore...
It's actually a campaign for
people to be told to go out and play. In
play.
Japan, telling their children, go out and play,
And in
go
Kenya.
out and play. This is a bad idea for our children to be stuck on their TVs, on the tablets, and even on books. Play is important. Play is important.
All work and no play makes
All
joy.
work and no play.
Thank you very much. This has been Good Morning Kenya. See you again tomorrow morning for another edition. A very big thank you to each and every person that made this show as fantastic as it is. A big thanks to Dr. Wanjiku.
Karibu.
Karibu sana.
Thank
We shall have this discussion even more.
Cool.
Keep the hashtag going. The hashtag Good Morning Kenya at KBC Television, at Jane Wambui, at Ram Aguko, and at Ray Manyara. God bless you. Have a good morning, and may God bless the work of your hands. Jane, over to you. Wrap it up.
All right, as God blesses the work of your hands, may He also bless the work of your eyes. May your eyes stay healthy and wise as always. Well, I think Ram has summed it up all. Be sure to join us again tomorrow right here on Good Morning Kenya. My name is Jane Wambui. Do enjoy the rest of your viewing. Have a lovely day, and God bless.